And now on to the program. Our first speaker today is Dr. Woodson, who will start off with a community case report. Dr. Woodson, thanks for joining us today, and please take it away.
Thanks, John. Appreciate the introduction. So today we're going to be talking about the communication crisis facing healthcare. Specifically, we're going to dive into, well, how does EMS contribute to this problem and how EMS can help address this problem. Then we'll go on, and Dr. Stein Bronsky will be joining us from Colorado Springs, and he will be talking about the role of EMS in uniting his community, basically go through the change management, some of the ups and downs of change management through this process, and then really come back with a summary as far as, well, is it worth it? Is it worth it to address this issue and problem that's facing healthcare? So the first thing we'd like to do is really take a step back and ask the question, what is the role of EMS? So not just the role of an individual that's in EMS, but what is the role of EMS as an industry? So is it more of just a simple method of arrival, the front line of defense, or are they truly a member of the healthcare team? In the community, are they a leader or are they a follower? Are they an agent of change and innovation in their community, or are they one of the factors that's a resistance to change in their area? So do we focus on the patient when we're just touching them, or do we focus on the patient's ultimate outcome? So I think these are questions that we need to ask, not just on a national level, but also your community and your local level. Those are things that we really need to think about and challenge. And I think that's a good introduction to really dive into what is the communication crisis? Where is it coming from? Why don't we talk about it? Why don't we hear about it more? So on your screen, you'll see several very high-profile things, and these are really big deals that we're often faced with. For instance, how many of us know someone that's been affected by breast cancer? Gun violence right now is a particularly raw topic and subject in America right now. The opioid epidemic. Most of us are really struggling with and dealing with the opioid crisis. We could go on and on with examples of this, but it's really important, if you just look at these on the screen, what causes more deaths than all of these combined? The hard answer is we do. I contribute to this. Most of the people that are joining this webinar today contribute to this. Basically, medical errors actually cause up to 400,000 deaths per year. That's a big deal. We actually cause 10,000 serious medical complications every single day. This costs the industry about $1 trillion a year. That's a massive, massive personal and economic effect. And 80% of these medical errors come because of miscommunications during transitions of care. So how many transitions of care do we go through in often simple EMS cases? We'll take one of the more simple things of something like a STEMI. So basically EMS, let's look at the communication specifically that EMS uses. So what we'll typically start off with is a old-fashioned radio report. So we'll pick up a 1970s radio, then we use a 1980s modem to basically bring in something like an ECG so we can transmit that over to the hospital. At the hospital, they're typically receiving that via either a blast, email, or a fax. Then EMS shows up at the hospital and they have to repeat that same oral report that they just gave 1 or 2 more times. Then at the hospital, basically the first person that takes that report is really a radio or phone jockey that's never going to touch the patient, but basically start hollering instructions to other people. We typically set off systems that have blast pages. We go from the blast pages to multiple phone calls, one-off discussions, trying to keep up with everything, repeating the same conversations over and over. So what if this is a transfer? Well, basically it's that whole mess, but on top of that, you're trying to put a transfer center in the middle of that, and then the whole process of involving EMS again. So look at the technologies that we're using: fax, radios, email, phones, pagers. That's how we're communicating in healthcare, and that's just a simple system of one hospital, maybe a transfer thrown in. What about if we're trying to actually do something more complex, like in Colorado Springs, multiple hospitals, multiple EMS agencies, they're all using their own technologies. We have to figure out how to communicate in the pre-hospital space, how to communicate in the intra-facility space, meaning basically teams that cross multiple departments, as well as in an inter-facility space. So I have North Carolina, that's where actually I did my medical training, and we basically dove into research in regional systems of care. One of the things about regional systems of care, especially when it comes to STEMI, we often focus on ECG transmission. Well, regional systems of care and communication is far bigger, far much more complicated than just figuring out how to transmit an ECG. If you look at basically the method of arrival, if we're only focused on pre-hospital ECG transmission and that's our solution to regional systems of care, only half our patients are coming in by EMS. We'd like them to all come in by EMS, but the fact is both our data and the national data, they don't. If you look at things like stroke, up to 2/3 of people are coming in by personal vehicle, and up to half are transferred at some point during their process. So if we're thinking about communication, trying to solve regional system of care communication, we've got to think broader than just the pre-hospital space. This is an EMS-focused webinar, but we have to think for and look for a comprehensive solution to address this problem. The problem is that we have, especially with all these archaic means of communication that have been around for decades, we've put all of our team members in communication silos. The only way you can bridge one silo to the other is a simple chain. Basically, you can only link them together one at a time. And so what we're seeing, if that chain breaks once, that system is in trouble, and specifically that patient is in trouble. The chance for medical errors and miscommunication goes up exponentially the more complex and complicated this team gets. Having different process and protocols for all these different methods of arrival, for all different time-sensitive emergencies or any cases that need to transfer across different healthcare entities is a problem. So the Pulsara solution, the Pulsara tool, basically is real-time team communication across healthcare entities. So if you break that down just a little bit, real-time, it has to work in real time. The data in our EPCRs, in our EHRs, it's not there yet for what we need for real-time care coordination, patient logistics, and moving these patients around. The next part of that phrase is communication across healthcare entities. So we need to be able to have a central hub for communication that you can rapidly build a team that crosses multiple EMS agencies, multiple hospitals, and multiple departments within those hospitals. That's what the Pulsara tool specifically is. The key thing, once you basically provide this type of platform, there's all kinds of things that you can do with it. You can provide instant feedback to all team members to really help close that loop. But one of the key things that we really have to focus on is this communication crisis is real. It has both massive personal as well as economic implications. So we as communities and healthcare leaders, we need to recognize and prioritize addressing this critical issue. So this simply requires change though. And so it's very important. We talk a lot about technology, but solving a problem like this is much bigger than technology. I think one of the things that you'll hear with Dr. Bronsky is not just things about the Pulsara tool, but also the Pulsara people, the team that we go into a community and basically help that community figure out how to go through the change management and operationalize basically solving this problem together. So Dr. Bronsky will talk a lot about the why and the how his community recognized and started to address this communication crisis head on. If you guys do want to see a demo of exactly what Pulsara looks like, please feel free to go to pulsara.com where you can see demo videos and learn more about the platform. But for now, I will transition over to Dr. Bronsky.
Thank you, Dr. Woodson. And now we'll turn to Dr. Bronsky for the second part of today's program. Please take it away, Dr. Bronsky.
Well, thank you. And my name is Stein Bronsky. I am the Chief Medical Director for Colorado Springs Fire Department and Medical Director for El Paso County, Colorado AMR. And I work as an emergency medicine physician for Centura out in Colorado. Just so that we can set the table here and you understand a little bit about our community, the city of Colorado Springs is approximately 650,000 people. We have 4 major hospitals, 2 hospital systems that each have 2 hospitals, another small hospital that just opened up that belongs to one of those 2 systems. We have approximately 50 feeding EMS agencies into those hospitals. And out of all of our 911 calls, we have about 65 to 67,000 medical calls per year right now. So our community, I believe, is pretty average with EMS communication. We like to think of ourselves as a pretty progressive EMS system in general, but when it comes to communication, I feel that we're pretty average, and we dealt with communication the same way that everybody else did, which is that we have these historical ways of communicating between the EMS agencies and between the hospitals and EMS agencies, and nobody ever really questions how that communication is done or if it's doing a good job or not, because that's just the way that it is, almost like a commodity. We have downstream communication like everybody, where we're trying to feed information from the EMS system into the hospitals and then back from the hospitals to EMS. And we deal, like many other communities, with the historical problem that we drop off patients, and then we want to know the information about patients and what's happened to them. We typically wait a tremendous amount of time to find out what those results are. Sometimes sooner, sometimes later, but it certainly is not as efficient as we would like it to be. We also have multiple types of communication historically. Everybody has radios. We have fax machines and faxing from the monitors. We use biophones to call in. There are all sorts of historical methods that are used depending on the EMS agency and if they have radio channels available, and all the typical types of arrangements that each system may have can be different from the next system that's just right next door. What this results in, even though I don't think that we acknowledge that very often, is a inefficiency in the continuum of patient care, because we are using these methods of communication that really are in sequence. And I like Dr. Woodson's slide with the chains, because to me that summarizes everything, where if you have one break in the communication chain, if that link breaks, then things break down. And it's really bad for the patient, because ultimately it takes a while to recognize that something has broken down. And even if you do recognize it, you might not be able to fix it right away. So where do we begin when Pulsara came to town and was introduced? I think that we deal with change like everybody else, where you present an issue and you present a solution. And just by human nature, nobody really likes the idea of changing because it's uncomfortable. And we do our best to try to move past that when it came to Pulsara, because I really noticed, as well as other people noticed, when we were introduced to Pulsara, about what could be the possibility of what our communication system would look like if we were to adopt a platform like this. And anybody who's worked in pre-hospital care be it EMS or law enforcement or anything to do with being out in the field, we all know that it all stems and all is based on how good our communication is. And whenever we have time critical incidences or disasters, everything boils down to how well you can communicate, to how well things go and how smoothly everything happens. And so our initial challenges were, how do you tackle this when we have over 50 EMS agencies? How do you tackle this when we have numerous hospitals and even numerous hospital systems? How do you get people to admit that maybe they have room for improvement? And what do you do with the agencies or the service lines within the hospitals that may give up some resistance because they think they don't need any help with getting better? And then specifically to Colorado, one thing that we always need to consider is how well is any type of communication going to work with our terrain and geography, which is a huge challenge. And then you have the never-ending competition, not necessarily between EMS agencies, but between hospitals or among hospitals, where they all want the competitive edge. And one hospital system may want a program or format like this, and they don't want the other system to have it because they think that they'll have a competitive advantage if they're the only people that have it. So what we did when we started was I and a few other people started talking to Pulsara. We then had to go to our community and start talking to all the hospitals and the service lines and EMS agencies to get a feel for collaboration and to set up this type of collaboration. The challenge was that we really wanted to do this as a full community all at once. We didn't want one hospital system to start and then by slow process bring more and more hospitals on. There's nothing wrong with that process, and I know that Pulsara has done that in many communities around the country. But for us, we really wanted to try to get our community as a community together and say we were going to make this change all together for the benefit of patients. And so we were able to get everybody on the same page, at least theoretically, and start the conversation, which is all that it took.